InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, and our guest today is Dr. Cherly Perlis. Welcome, Dr. Perlis.
Welcome. Thank you.
Well, Dr. Perlis is a board-certified physician with extensive training in bioidentical natural hormone replacement, cosmetic medicine, and longevity medicine. Men and women of all ages are invited to experience Dr. Perlis's unique approach to wellness and rejuvenation at the Perlis Wellness Center in Lake Bluff. First question for you, what does bioidentical hormones mean?
Actually, it means it's actually hormones that are in our body that are exactly what we have to begin with. So their chemical structure is exactly the same as what we have, not an altered compound.
Now, you started to make it a focus of your practice. Why did you do that?
Well, first I personally experienced, I had a friend that asked me about bioidentical hormones, and she said, I really need them. Can you start using them? Or can you start prescribing them? And I thought to myself, I started reading about it and researching, and I looked through this book by Christiane Northrup called The Wisdom of Menopause.
And she's a physician.
She's an OB-GYN, actually.
Yeah.
And I was very fascinated by a lot of these patients' symptoms. Or she described anxiety or depression, fatigue. And I started to realize that I had so many of the symptoms that were very subtle that could be cured or taken away from by using natural or bioidentical hormones.
And so what are some of the bioidentical hormones?
Well, usually they're estrogen, testosterone, progesterone. I use thyroid medication as well. So there's a range of them depending on what your needs are, is what I prescribe for patients.
Now, do you have special bioidentical hormone training?
I actually did. I flew to New York City to work with a renowned leader in the bioidentical hormones. Her name is Dr. Erica Schwartz, and I trained with her, and then I took numerous seminars, and I really started to listen to my patients' complaints, and I started to hear what their complaints were, what was going on with them.
And so what are some of the common symptoms or complaints you hear from your patients?
Well, a lot complain. I would say the number one thing is fatigue, moodiness, irritability, lack of energy, foggy thinking, decreased sex drive, of course hot flashes, weight gain is a huge.
But all of those symptoms you just described can also be symptoms of stress.
They can be, but you can remove a lot of those stress and still feel fatigued. You can still have hot flashes even if you remove stress. So a lot of those symptoms really, first of all, you can't live in a bubble, okay? So you're going to have stress, different varying of stress, how people handle stress in different ways. I agree with you. So, but the general population, they come in wanting an answer. They want a treatment. And if I say remove all stress from your life, how are they going to quit their job?
Yeah.
So it's hard to...
Or get rid of their children or their spouse.
Really. Live in an igloo. That's what I say. Then you won't have stress.
Yeah.
So that's why I started really paying attention to these symptoms. My training, we never talked about... We learned you use hormone therapy when you have no more periods for 1 year, hot flashes, vaginal dryness. That's the training that I received. I never realized there was numerous symptoms that led up to that. And I was a classic example, and that's what motivated me so much.
Now, before the show, we were talking about your clinic and how you had a guest speaker talking about water. Can you say a little bit about, like, some of the classes or other services you offer at your clinic?
Well, first of all, I see both men and women at my office. I also, I'm very holistically, I talk about the supplements to patients. I talk about stress management with patients. I do a lot of cosmetic procedures that I like doing that will help them feel better. So once they start feeling better with the hormones, they want to do like Botox or Restylane or other cosmetic procedures to their face. So I do those as well.
Okay, can you talk a little bit about like the cosmetic procedures that you perform?
That I do? Okay.
Yeah.
I do regularly Botox or Dysport, and that's for frowning right in the front here. A lot of people lose a lot of volume in their face, and so we can add volume using dermal fillers. So that's another thing that I use. Laser. I have a laser hair removal as well as sunspots. And if you have small veins around your nose that we can laser. So it's a range of services that I provide. But the bottom line is I want to help the person feel better inside, and then if they desire to do external things, I think that is all beneficial.
Did you ever hear of Dr. Maxwell Maltz?
No, no.
He was a plastic surgeon. I mean, graduated medical school in like the 1920s. And so people would come to him and say, Dr. Maltz, please do plastic surgery. And he'd examine him and he'd say, you're beautiful. You just need to change the way you look at yourself. And then other patients would come in, you know, that were burned in a fire, injured in an accident, or had a birth defect. He'd do plastic surgery. And they come back for follow-up visits. And he said, my God, their personalities are completely different. And, you know, I said, I did nothing to their minds. It has to be the way they look at themselves. And so he really created self-image psychology. And psychologists believes that one of the greatest discoveries of last century is you can change the direction of your life by changing the way you view yourself.
I totally agree with that.
Yeah.
And I see a lot of changes that people have once they use the hormones. There's a study that shows that people that are using hormones will look 10 years younger than the people that are not using them. So they make a significant difference in your overall appearance as far as your skin thickness, less wrinkles, overall well-being.
Well, self-image, self-respect,
right.
A person's mood, because you talked about feeling anxious or irritable or depressed. Yeah.
There was a study that just came out between 40 and 55, 20% of women experience depression secondary to a decrease in their estrogen, which causes a decrease in their serotonin levels.
Now, is there anything that that a person can do with the diet or exercise?
This is the bottom line. There's no replacement for the actual hormone, but absolutely, if you exercise, and I tell every single person I talk to them about exercise. I think that's key. But I'm telling you honestly, I had a perfect diet. I don't eat meat. I'm organic. I exercise an hour a day, and I still felt tired, and I still needed hormones. So the bottom line is you can't replace something that your body, actually needs, and I see it every day in the office. I mean, if I didn't feel it differently myself, but then go to witness, patients come in, they're all confused, their hair's messy, they have no makeup on. The next month, after being on a month on hormones, they feel like a different person.
And when were hormones first discovered?
They were discovered probably in the 1950s, and that's with the Premarin, which is made from a pregnant mare's urine, so a horse's urine. And that was initially the hormone which was discovered. As time has gone on, we've developed more specific hormones, and now I'm using the bioidentical, there are FDA manufactured bioidentical hormones available to patients. But it's just not dose titrated. It's one pill fits everyone.
And you think it needs to be more specific?
I love it because if a patient has a very specific, see, they don't sleep well at night and they complain of insomnia, I can increase their progesterone level, which helps them sleep better. So I can titrate it according to their symptoms. And not everyone responds to each hormone exactly the same way. So I start with a basic level, and then I alter it according to their symptoms and how they feel.
Now, I supposedly, like people who smoke marijuana, or men who smoke marijuana, their testosterone level drops. Now, from when the hormones were first discovered in human beings, have they noticed that they've been dropping, let's say, in comparable aged men and women?
I think they have been dropping. I think what's happening is, I don't know if there's a study saying they're dropping more than they used to. What's happening is we have a lot more toxins. We have a lot more stresses in our environment. And so people are living longer in disease states. That's the bottom line. So now people are in their 80s, and you know, if someone passes away in their 70s, you feel like, wow, they really died young, where people used to not live that long. So we're living longer, and more people are on multiple medications. And that's really kind of upsetting to me.
And why don't you think more doctors know about bioidentical hormones?
I think the bottom line is you have to be open-minded. I mean, people learn what they're taught in residency. Unless it happens to you or circumstances occur, it won't push them to the outside their box. So even, you know, so they won't even consider it. So that's why I'm seeing so many patients, because they're looking for answers. They're tired of just taking a pill for this, taking a pill for that. They want to know the cause. Why do they feel so lousy? I mean, I had a person come in over 50. He's like, I feel old. I mean, what's that, 50?
Yeah.
You know, it's a shame.
So do patients specifically seek you out because of your bioidentical hormone training and practice, or they come in for some other reason and you just go, wait a second, I know what's going on here?
Well, to be honest, both, actually. A lot of people I'm referred to by other patients. Some primary care physicians are referring them because they don't know what to treat the patient. They don't want to take an antidepressant. That's like the treatment for feeling down or feeling fatigued. They'll immediately give a pill. We've trained our society or our patients to always ask for a pill instead of like look at the whole person. Listen to your patients. You know, listen, they just want to be heard. I mean, our society has gotten, or at least in the medical community, maybe this is different for some, but the majority are, you know, they have to see a patient every 7 minutes or every 15 minutes. How much can you really find out in that amount of time? If they have a complaint, why just give them a pill? So I really believe like I'm a medical detective. You know, I need to get to the bottom of what's going on for them.
Okay. And what medical tests help you treat your patients?
Well, I always do I like to follow protocols. I'm a conventional doctor. I've been trained conventionally. So there's basic tests that I order for both men and women. And from there, I use that as a baseline.
And so what are some of those tests?
I would use, like, for a man, a PSA test, a testosterone level, a DHEA level. I look at their basic chemistry. I look at their lipid profile. And for women, I do the estrogen level, the progesterone level. So I really look at the levels, and I use them, and as well as thyroid. That's another thing. The thyroid is very undertreated. 60% of our population is walking around hypothyroid.
And do you have any reason, any suspicions why so many people are hypothyroid?
Oh, I do, because are you using iodized salt? No. Most people use sea salt, kosher salt. Unless you're using an iodized salt, it's very hard to get iodine in your diet. Plus, it competes with chlorine and fluoride and bromine in our water, so we're really depleted of iodine. So if you take iodine as a supplement, it's a great way to help get your iodine and help your thyroid work.
And so does an iodine deficiency show up in a medical test?
No, it's hard to find that. You have to go by the symptoms and look at their labs and talk to them if they're fatigued every day. I mean, I would put a person in my office on iodine, and she lost 12 pounds. Just made her thyroid work better. Because the thyroid, the T3, which is the active part of the thyroid, needs to bind with iodine to work in the tissues.
And doesn't the thyroid also involved in the uptake of calcium?
It does. It's involved in every process in your body. The thyroid is really a key player.
And it's interesting because it's in our neck, which is part of our communication process.
Right, exactly.
Yeah.
And so we really need to be focusing more on the thyroid.
Okay. And what types of hormones do you prescribe?
Depending on the person, if you're a man, I would not give you estrogen. As a man, I usually use testosterone, and I use a bioidentical testosterone, as well as I use a thyroid medication as well, either Synthroid or Cytomel. If it's bioidentical, then I would use a Synthroid and a Cytomel.
Now, and so then the patients come in for follow-up after you prescribe medication.
Yes.
So you check the labs to see that the movement is in the right direction?
I do. For men, I do. And also, however, I check their symptoms. So say that their labs look good, but they still feel lousy, then I need to look elsewhere. I need to see, are they absorbing the hormones? A lot of the hormones I use in general are in cream form, because then they can bypass the liver. And for women, for estrogen, it increases, if you take an oral estrogen, it increases your blood clotting factors, so that increases your risk of stroke and other mechanisms. So I use always in cream form. So I use estrogen, progesterone, and testosterone for women.
And so the cream form, do they just rub it on their hands? Or they
Right, it's in a pump, and
okay.
I just rub it like this. It's kind of idiot-proof because they give you exactly the right amount.
Oh, and each dosage? Yeah.
Yes, and I use a compounding pharmacy that makes up specifically the quantity that I need, or the level that I
Did you
want.
develop this cream?
No. There are compounding pharmacies that are very reputable that do numerous hormones.
Okay, so how long will it take for those bioidentical hormones to kick in and help a person?
Probably, it depends how bad your symptoms are. Most women, it takes 2 to 4 weeks. Men, probably a month, 4 weeks. Maybe sooner. Some people are very sensitive and they work right away.
And is there any contraindications for any bioidentical hormones? Or
if you were a man and you had a prostate tumor that was not treated, the testosterone could stimulate that. So if you have an elevated PSA test, I would advise them to see their urologist first. Then once they're treated, it's okay to use the testosterone. For a woman, if they had a breast mass, so they actually had a lump in their breast, they would need to be evaluated, because if it was estrogen sensitive, I would be giving them a cream and it could stimulate the tumor to get larger.
Now, do you work with any other medical specialists?
In general, if I can find one.
Yeah.
It's very hard for me to find a holistic physician who's in the same, who strives to really prevent disease and really help the patients in that way.
I think there's like a holistic physician organization.
There is, but there's not a very many around this area. I know a holistic migraine neurologist. I know a holistic psychiatrist, but they're very limited.
I think both of them I've interviewed and are members of Infinity.
Maybe they are. I know one of them is.
Yeah.
So it is hard to find, because it's really, patients have to seek you out. And I think patients have to be committed in a different way than the regular, hi, I'm here for my pill. It's more than that in an appointment.
All right. What about insurance? Does insurance cover the hormones?
Actually, 50% of the insurance cover the hormones. For an example, I will tell you that if you got a testosterone from the compounding pharmacy, it's $50, okay, whether the insurance pays for it or not. If you go to Walgreens...
How long will that last?
A month.
Okay.
So if you go to Walgreens and get Androgel, it's $498.
What?
Yes. So that's kind of a difference. So what I have found is androgel is testosterone.
Is that prescribed? You can only get it with a prescription?
Yes.
Okay.
So a lot of times what I'll say is, well, if you want to get it from the pharmacy, that's fine. I can write you for a bioidentical hormone from your pharmacy. But they always call me back and say, well, I might as well just use a compounding because it's more cost effective. So it's interesting. They're kind of like, you know, they're a very big pharmacy that produces a mass amount of cream, hormones in cream form usually.
Mm-hmm. Okay. Do men experience menopause like women?
They do, but it's not as, like the classic menopausal woman is hot flashes, insomnia, sweating all the time. You know, men are subtle. So they start getting tired, they get a little pot belly, they get a little depressed, they're watching TV, using their clicker a lot, you know, not focused. They kind of just slow down. Their workouts, you know, they may be working out, but they're not building muscle mass. Mm-hmm. And that is all a lack of testosterone. So it's very gradual for men, but a lot of men that don't come in, they don't even realize it. They go to the doctor, they say, oh, I need Cialis or Viagra, mm-hmm. you know, instead of really looking at just using testosterone.
No, like I know some men in their 80s and they're still vibrantly active doing physical work.
They're on testosterone.
You think? Well, I don't
think a lot are. I do. I think more than you know.
Well, I'm thinking of like one of my neighbors. You know, throughout his life, he just eats the foods that he grows, he hunts, or fishes.
Well, I agree. If you do a lot of that, if you're active, you have a great diet and are really consistent with it, and exercise well, I think you can bypass it. But I think at a certain point, you start to get osteoporosis. Testosterone prevents that. You want to build a little muscle mass. You know, so I think it's just relative. The majority of patients I see don't come in exercising an hour a day, totally organic, making their own food, not processed. It's a rarity. That in itself is a full-time job.
Yes.
It is full-time to be healthy.
And you have children, right?
Right.
And you're setting a good example for your children by your diet and lifestyle. You got any tips for parents? Because, you know, you want your children when they're in their 40s and 50s to make good choices and to acknowledge that maybe they need some help.
Well, a good thing, my one child always wants to go to McDonald's. That's his big thing, McDonald's fries. So every time he says that, I say, guess what? I will go home and cut you some potatoes and make you homemade fries. Or I mean, I just cut it. We don't do that anymore. Mm-hmm. So I think the bottom line is if you don't go yourself to McDonald's, we never eat at McDonald's. So you're starting to like plant a seed. Mm-hmm. And then gluten-free. I try to be gluten-free in the house as well. So it just is about making smart choices.
And what is, you know, I hear a lot about that gluten. What is it about gluten that's harm? I know some people may have allergies, but what's harmful about it?
Well, the thing about gluten is it causes depression and anxiety for some people. Mm-hmm. So if you tend to be depressed or anxious, you want to stay away from it. What has happened is they've altered the wheat so that a lot more people are sensitive to it than they ever were. It's also the way they rapidly rise the bread that's causing all this discomfort for patients. My son had it. I had no idea. The only thing is we took him someplace and he said, stop the gluten. I took him to a doctor and the doctor said, you need to stop dairy and stop gluten. And so once he did that, he realized that all these years he was having all this diarrhea as soon as he got home from school was related to what he was eating.
Mm-hmm. Then is there a test that can...
There's actually a test that you can do it. It's very expensive, but there is a test that you can order. Your doctor can order it to actually test to see if you have it. My whole thing is that regular breads and pastas raise your blood sugar, and then it drops. So you have like a high and then a low, and I want even keel blood sugar. I don't want to be like shaky or like really uptight and then low. So I think gluten-free, it keeps you with a stable blood sugar in general. So I feel better not eating gluten.
And could a person follow a gluten-free diet that's tasty?
Yeah, you don't have to be like every little ingredient. Just cut out the breads, cut out pasta, rice noodles, eat a Japanese diet type style. I mean, I don't feel deprived at all. You know, I just actually feel healthier.
Okay.
And actually, I don't even have a gluten sensitivity. Well, actually, probably now I do because I haven't eaten it for so long.
All right. I want to get back to the bioidentical hormones in case our audience wants to find out more information. After you prescribe the hormones, where do your patients purchase them? Is that the same, the option between getting it from you with the cream and going
Actually, I have a compounding pharmacy that I use. One is in Michigan called Diplomat Pharmacy, and the other is Restore Pharmacy in Madison.
So can they order it over the internet, or you
I
have to have a
actually
medical?
prescribe it
Yeah.
for them, and then we send it into the pharmacy, and then they actually ship it either the next day or in 2 days.
Oh, that sounds.
And then they ship it regularly to them, and then I can adjust the dose accordingly. So I always know what's going on with the patient.
Are the hormones FDA approved?
There are bioidentical that are FDA approved. If they're used in a compounding pharmacy, they're not considered FDA approved.
Okay.
But you can get an FDA approved bioidentical hormone from Walgreens. Not everyone in cream form.
Okay. Now we only have 2 minutes left.
I'm sorry.
No, that's okay.
There's so much to talk about.
Well, that's why I wanted to give you a chance if there's something specific that you want to
Well,
talk
one
about.
thing is that the testosterone level I use for women, because the ovary makes 3 major hormones, estrogen, progesterone, and testosterone, there's no level that you could ever even get FDA approved for. It's such a low level, and that's why I use a compounding pharmacy for their testosterone. But I think there's a lot of women, especially women that are suffering, that don't know where to turn to, as well as men. And I think that they need to look into going on the bioidentical hormones for their future.
Well, I think it's great that there's more females who are doctors. Do you find that female doctors are kind of championing this bioidentical hormone movement or awareness?
I think it may be more obvious to us because we're experiencing those hot flashes so intensely that we'll be motivated to look elsewhere to find the answers. But I think it is just so individual on like the physician. What does the physician want for their patients? Are they willing to be a medical detective and to prevent disease instead of treat it once it occurs?
Okay. Thank you so much.
Thank you.
For more information about Infinity Foundation, InnerQuest Talk Show, or Dr. Cherly Perlis, stay tuned to the credits at the end. Until next time, wish you good health, good spirits, and good fortune. Thank you again.
Thank you.
For more information about this show, our guests, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831-8828.